Hi everybody, congratulations. You have just completed Unit 1 of the First Aid Response Training course. In this unit, we have looked at who the First Aid Responder is. You as a First Aid Responder will be certified by VEC. VEC is the Pre-Hospital Emergency Care Council. In order to keep your certification, you need to renew your training every 2 years. Okay, a first aid responder is a person who is certified by VEC. To do first aid, you don't need to be a first aid responder. Anybody can complete or carry out first aid. What is first aid? First aid is the definition of first aid is the initial help or treatment given to a person who has been injured or suddenly taken ill. And there are 3 aims of first aid. The 3 aims of first aid are to preserve life, prevent further injury, and promote recovery. Okay, now we're looking at the chain of survival. The chain of survival is a continuum of care that we should comply with should we come across the worst case scenario where an incident has progressed to cardiac arrest, which is the medical term for when your heart stops. How do you know if somebody's heart has stopped? There are 3 signs of cardiac arrest, and we're going to look at this in more detail in Unit 4. The 3 signs of cardiac arrest are not responding, not breathing, and 40% of people who initially go into cardiac arrest will complete or carry out agonal breathing or gasping. So the 3 signs of cardiac arrest are not responding, not breathing, and gasping. So if we find somebody in cardiac arrest, we comply with the 5 links of the chain of survival. Early access. We call 999 or 112. Once we have done that, we need to very quickly commence CPR, which is cardiopulmonary resuscitation. Once the defibrillator arrives, which is the 3rd link in the chain of survival, we need to very, very quickly, immediately turn it on and follow the guidelines. When the ambulance arrives, we want the person to go in an ambulance to hospital. And that is simply what the 5 links in the chain of survival are. They are known as early access, early CPR, early defibrillation, early post-resuscitation, early ambulance, and early post-resuscitation care in your hospital. Okay, we have then given you a list of the contents of the first aid kit. So hopefully your instructor has talked through that content list. And what I want you to realize is don't overcomplicate your first aid kit. If you don't know what to pull out of your first aid kit, use the triangular bandage. It can be used to compress. It can be used to do arm slings. It can be used to stop a bleed. Sorry, I said that with compression. It can be used to cover an eye. It can be used to wrap an iPad or an ice pack in. So the triangular bandage is really, really something that you should be very familiar with within that first aid kit. Okay, we then looked at guidance of the AED. An AED stands for Automated External Defibrillator. And it is up to the person who buys or brings the AED into their workplace to make sure that the AED is maintained, okay, as per guidelines from the manufacturer. It is important that we make sure that the defibrillator is accessible to everybody, that it is charged and maintained, and that people have some training for actually carrying out use of an AED. The first aid room, I've already talked to you about the first aid room and the contents of the first aid room. And then guys, to kind of put everybody at ease, you are all covered under an act. That act is called the Good Samaritan Act. So if you give help or treatment to somebody who's been injured or suddenly taken ill, and you don't do that treatment correctly, don't worry, you're covered under the Good Samaritan Act. However, as mentioned previously by your instructor today, there are 3 times when you may not be covered under this act. Those 3 times are if you ask for payment or reward to carry out the treatment. So don't ask for money to carry out the treatment, hopefully you won't. If you are grossly negligent, so for example, if somebody is choking and you decide to slit their throat to remove the object, hopefully you won't do that either, that's gross negligence. And the 3rd time is abandonment. So if you're with a casualty and they are experiencing a life-threatening emergency and you contact medical services, don't abandon the casualty. But if you need to be somewhere, it is okay to hand over to somebody else and get that competent adult to hand over. Okay, so we're going to go on now to Unit 2 of the first aid course, and Unit 2 is patient assessment. I hope you enjoy Unit 2, and I'm going to do an evaluation again at the end of Unit 2. So enjoy everybody, and thank you so much for using Pro Training Courses.